The word went out in the fall and people listened and lined up to get their flu shot, especially after last year's deadly H1N1. But new information from the Centers for Disease Control says this year's flu has mutated, making the vaccines we already got less or not effective. There's a different flu going around than the one we got shot for. Whoops.
The experts make a guess as to what's going to be circulating in the fall, and they guessed wrong. And so what they guessed was for one of the strains, the H3N2, they chose a different one than is circulating now.
For those who say flu shots are useless, this may reinforce their resolve. We've even heard flu vaccines referred to as corporate syrup. Dr. Bloomberg says about half the country gets an annual flu shot. As for the other half, it's not known if it's disinterest, disbelief, cost, or lack of access. Flu season peaks starting now through February. This national map shows where the flu outbreaks are right now. California, in light green, is experiencing little in terms of flu issues. Dr. Bloomberg says this year's flu vaccine was created in the spring. Although it doesn't match the current strain, it still gets your body ready.
It means that instead of being the usual flu shot will protect you like 60 to 70% of the time, it means it's going to be less effective. And I can't really put a number on that, whether it's going to be like 40, 50%. It's still going to provide some protection, but not as much as we normally expect.
There is no updated vaccine to match the current strain. In the meantime, the CDC still recommends getting the available flu shot, especially for seniors, children over 6 months of age, and those who work in close contact with the public.